was upset to try.
Good.
We just rebooted it. It was a full mail.
Sure, Rob, we're now live on YouTube. Okay, thank you. Good morning, everyone. It's 9 o'clock, July 27th. We are in the new PEP boardroom at 3427 Gonai Road in Carson City. It's our first meeting in this new boardroom, and I'd like to call the meeting to order. Roll call, please.
Hey, Chair Rob,
Here.
Jim Barnes,
Here.
Betsy Aiello is excused from today's meeting. April Karen,
Here.
Leslie Biddleston,
Here.
Jennifer McClendon,
Here.
Janelle Woodward,
Here.
Michelle Kelly,
Here.
and Betsy Strasburg.
Here.
Thank you, everybody. We have a quorum.
Thank you very much. We will close agenda item number 1, move on to agenda item number 2, public comment. I see no public in Carson City. Do we have anybody on the line to make public comment today?
Yeah, but we have a couple of Chair Rob, one moment. I'll get the slide up and everything.
Okay, thank you.
As a reminder, Zoom is used for public comment only. This meeting is streaming live on the PEB YouTube channel if you want to watch the board meeting there. The link to the YouTube live stream is located on the agenda. For those who have joined for public comment, your name or last 4 digits of your phone number will be announced and you will be advised you have been unmuted. As a reminder for those on the phone, please press *6 to unmute. Please slowly state and spell your name for the record and proceed with your comments. Due to time considerations, each caller will be limited to 3 minutes. Douglas Unger, do you have permission to speak? Please unmute your mic and slowly state and spell your name for the record.
Doug Unger, D-O-U-G-U-N-G-E-R, President, UNLV Chapter, Nevada Faculty Alliance, and Chair, Government Affairs Committee. Thank you to Director Rob and the PEB Board for your service and consideration. As we close the 2023 fiscal year and launch into the new one, we would like to point out some serious issues with UMR and its claims administration. As is clear in the audit findings for agenda item number 9, UMR failed to meet service expectations in 5 key areas. UMR's administration of patient claims has excessive errors, and the medium and mean time for claims turnaround are unsatisfactory. The underperformance by UMR has led to real-world consequences for several faculty and university employees, including unreasonable delays in resolving claims. In at least one case, a letter sent by UMR to a UNLV employee stating her claims and appeals had been resolved in her favor and would be paid, only to find out that the claims department at UMR persisted in informing health provider billing offices that her claims had been denied, sending some bills wrongly into collection and causing significant personal anguish and frustration to the employees such that she was on the verge of quitting her job. Another claim took no less than 5 months to resolve. The faculty member caught in seemingly endless telephone response loops until the former executive officer intervened and resolved the matter. There are at least another 5 or 6 such cases currently bouncing around the UMR system. This poor, impersonal, tone-deaf service to PEB members cannot and should not happen. We strongly request, as was in place with HealthScope, that PEB work with UMR to create a patient advocate position that responds directly to members who are having claims, payment, or approval issues and help to resolve them. As well, UMR has recently cut Desert Radiology from its in-network providers effective August 1st. This decision will reduce access to diagnostic imaging services in Southern Nevada for PEB members by about 40% and is already causing scheduling problems in a region which has been long underserved. Furthermore, without an announcement of this decision by UMR and explanation to PEB members, there will be mistakes in accessing in-network providers that will cost state employees unnecessarily and lead to further frustrations with PEB. In sum, I hope that PEB staff and the board can work aggressively with UMR and its parent company, United Healthcare, to resolve these serious customer service deficiencies. Thank you.
Thank you. Duly noted. Do we have any further public comment?
Yes, we do, Chair Rob. Caller with the last four digits, 6837. Please slowly state and spell your name for the record if you wish to make public comment.
Hello, this is Kent Irvin, ERVIN, past president of the Nevada Faculty Alliance. Good morning, Chair Rob, Executive Director Glover, and committee members. I would like to comment on how PEB participants fared during the legislative session. We did get partial restoration of benefits, but there was more than enough surplus money in the budget to fully restore PEB benefits to pre-pandemic levels, as evidenced by the restoration of basic life insurance and supplemental HSA, HRA contributions. But when legislators asked how to fully restore benefits, PEB staff told them it was too late to make any plan design changes for FY 2024 and offered no other solutions. That was frankly contrary to the intent of the PEB board, which had asked for full restoration to be submitted as a budget option. If the PEB plan timeline is indeed incompatible with the legislative session timeline for the following fiscal year, then structural changes are needed to be made. For example, by moving the plan year to the calendar year, which is in PEB's power, or at least by offering plan changes for the second year of the biennium in the budget requests. Strategic planning is needed now for plan design changes for FY 2025 and beyond. The PEB board should be proactive in requesting options. How can pre-pandemic benefits be restored, including long-term disability insurance? How can the HMO EPO plans be revised to eliminate co-insurance and deductibles, which are not in traditional HMO plans and were added as budgetary measures? How can the three plan levels be better differentiated to provide true choices to participants? Finally, as a very recent retiree as of June 30th, I am seeing how slow PEB processes are for transitioning employees to the Medicare exchange. Despite submitting my documents early, I still do not have access to my health reimbursement account funds, and I was informed that it takes 8 to 12 weeks for PEB to process that after it receives the termination notice. PEB needs to automate those and similar processes and to work with the benefits manager in the upcoming RFP to make sure those processes work more smoothly and automatically. Thank you.
Thank you. We have one more public comment.
Yes. User who put in SSMINGTON, you have permission to speak. Please unmute your mic and slowly state and spell your name if you wish to make public comment.
Hello, my name is Sharon Symington, SIMINGTON. I did not submit a request to speak, so I did not feel I could at this point. I did have some concerns about a recent phone call I had from a PEB employee about my benefits ending, and so wasn't really sure how I go about that. I did find your website and did find that there was allowing to make public comments, but I did not prepare for that. So.
If it's possible, if you could drop off of the Zoom call and listen to the meeting on YouTube. The lobby you're in right now is just for making public comment. I apologize for that.
Okay, I apologize. I wasn't aware of that. I was just trying to get some information. Thank you.
It's okay. I just want to make sure that if you did have public comment, you were able to make one. So apologies for that.
Thank you. I appreciate that.
Okay, thank you. That concludes public comment. We'll move on to agenda item number 3, PEB board disclosures for applicable board members from the Attorney General's office.
Good morning, everybody. Thank you, Chair Rob. This is Radhika Kunal for the record. This agenda item is to allow me to make a disclosure regarding conflicts of interest on behalf of the board members who are eligible for PEP benefits. Pursuant to NRS 281.420, on behalf of the board members who are eligible for PEP benefits or whose families are eligible for PEP benefits, I offer this disclosure that they will be voting on those items that may affect the benefits available to them or their family members. The law does not require abstention from voting merely because the board member or their family member is eligible for PEP benefits. At this time, I invite any member of the board who has any additional disclosures to make it now. Thank you.
Thank you. Anybody have any further disclosures they need to make?
Betsy Strasberg, I'm the new member of the PEP board, and because of the process, the orientation process has not been completed, I will not be voting on any matters today that requires a vote.
Very good and welcome. We're glad you're with us.
Thank you.
Okay, we will close agenda item number 3, move on to agenda item number 4, consent agenda. Consent agendas will be considered together and acted on in one motion unless an item is removed and considered separately by the board. Has everybody had time to review all the consent agenda items? And does any board member wish to pull any of the items for further discussion? I can't see board member Kelly. Are we good? Do we have any on the consent agenda we need to pull? Seeing none, I'll entertain a motion to pass the consent agenda as presented.
April Carn, I'll make a motion. Leslie Bilston, second.
We have a motion and a second. Any further discussion by the board? Seeing none, I'll call for the vote. All those in favor signify by saying aye.
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 Anyone opposed? I think that was unanimous. So we're good. Motion passes. We will move on to agenda item number 5. Discussion regarding the status of recruitment for permanent appointment to the PEB executive officer. I will go through this morning. I've worked with Mandy Bowsmith and met with our interim person yesterday. We are, as everybody knows, rolling, maybe you don't know, but we had the same problems with LSI as did the PEP board. And we terminated that contract and we are moving off the Smart 21 platform. And we are rolling back to our legacy system in Advantage. That has caused us some hiccups in being able to post recruitments. We are getting there. This recruitment will be posted within a week. We are going to post it on the state website, and then we are going to work to post it. There's professional trade associations that have associates with. They have websites. We're going to post that position on those websites. So it will be posted in a broader audience, but we are not at this point looking to go through a recruiter working with DHRM. We've discussed going through a recruiter, but we can discuss that as a board. This is an item we can discuss and figure out a way forward. It's information discussions are not really an action item. I'm just telling where we're at. But in the discussion we've had with Mandy, our recruitment ability to bring people from out of state right now with the salaries of the state of Nevada is extremely limited. So hiring a national recruiter going to that expense is going to extend the timeline and probably not bear much fruit. We find this in other arenas. I know that other entities do this, whether you're a county entity or a university, they have the ability to pay a whole lot more for employees through nationwide recruitments. But with the current cost of living in Nevada, if they move from another location to Carson City or Reno to take that position, it would most likely be a pay cut for them with the increased cost of living. So that's our thought process. I would entertain discussion if somebody has any other avenues they want us to explore. But at this point, it will be posted next week. And we will post it on national associations to make sure that we have a broader reach. Any questions? Board Member Kelly, do you have any questions?
Yeah, I do. Thank you, Chair Rob. I was trying to work out how to raise my hand. Good morning, everybody. So, Chair Rob, I'm just wondering. I kind of understand your point of view that the salaries aren't necessarily competitive for top-level executives. But I'm just wondering. I know that during the legislative session there was a bill. I'm pretty sure it passed that removed the prohibition, I guess, against paying salaries more than 75% of the governor or whatever that number was. So excuse me if it wasn't 75%. Does that not give the PEBP some flexibility in our hiring for the executive officer?
So I will. Go ahead.
So this is Celestina Glover, the interim executive officer for PEB. That exemption was removed or was added, but for PEB specifically, the exemption we already had in place was actually eliminated. So we are left with whoever the executive officer is that is hired will be limited to whatever the pay was approved in the legislative pay bill. So at one point, PEB was exempt, similar to PERS. That no longer exists.
Okay, and what is that salary? Are we allowed to say that in public forum? I mean, it's going to be posted, I assume, with a salary, right?
The compensation schedule hasn't come out yet for the unclassified. So I can tell you it's 12% of the 2022-23 fiscal year.
Okay, that's fine. I can go out to the pay bill and find it myself. Okay. So, I mean, if we're advertising in that way, are we confident we're going to get a good pool of applicants? I guess, health insurance is so important, and we constantly are hearing from employees about, with all the changes, just about them not feeling heard, I guess, is kind of what I'm hearing from them. And so I just kind of want to understand, are we going to get to look at the job description again? Has someone done that to make sure that the job description is accurate and actually fulfills what we're looking for in an executive officer? Someone who is employee centric and, has managed health insurance plans from a fiscal responsibility, but also from a client participant angle as well, because I just feel like we're missing some of that at the moment.
Jeff, off the record, I appreciate your comments and concern. The job posting, this job has been vacant multiple times in the past 5 years. So we were looking at the former qualifications, making sure there doesn't need to be any updates. And before we post it, we will make sure that we have the salary range that has been approved, the 2022 year salary plus 12%. We'll make sure that that is included. So it's very transparent on what the salary will be coming forward. Like I said, with this job being posted multiple times in the past 5 years, we're looking at that, and board members, I would welcome to look at the posting. If there's anything we need to update, we can do that. We do want to make sure that we get all qualified individuals that would be interested looking at the job. So we're going to do everything we can to make sure we have multiple options to look at.
Thank you, Chair Rob.
April Karn, I have just a quick question. Have we considered opening up the recruitment statewide? I do realize PEB is located here in Northern Nevada, but maybe to broaden our pool, have we considered maybe allowing someone to work in Southern Nevada?
Jack Rowe, for the record, I think that will be a point of discussion when that time comes. We can definitely open a statewide and have that as a discussion point. It would be something that the board would have to really discuss and determine. I understand what you're saying, and we're looking at that for other agencies doing a lot of job postings statewide. The state is currently purchasing 18 buildings in Southern Nevada to house a lot more state employees. And with that type of transition, we know that some jobs are easier to fill in Southern Nevada, so they will be open statewide. It's something we can entertain. I can instruct Manny to post it statewide just to see if we do get different applicants. So, but it would really have to be a discussion on current business practices, current location of staff, and how we would make sure that that is the most efficient model to run this agency. But it's something that we can definitely do. I will instruct Ms. Postsmith to open statewide. Any other discussion?
Chairman Rob, Betsy Strasburg. So in lieu of the nationwide advertisement for this position, will there be any consideration for referral bonuses perhaps?
Jack Rowe, for the record, we are currently looking for referral bonuses as something we do for all state employees. That's something that our contract, it's the contractor is helping us try to figure out how to fill state positions has brought forward, but we do not have an avenue for referral at this point to pay those bonuses. It's something being considered, but it is not a formal process that we can do at this point. And we're not doing getting a recruiter to do something nationwide, but we are putting out nationwide job postings through professional organizations. So there is a nationwide approach to do this also.
Thank you.
Okay. Any other questions? Seeing none, we'll close agenda item number 5, move on to agenda item number 6. Election of board vice chair pursuant to Nevada Administrative Code 287.172. Eligible candidates: April Caron, Betsy Aiello, Michelle Kelly, Jim Barnes, Leslie Biddison, Janelle Woodward, and Jennifer McClendon. This is an action item. Any comments, or do we have any nominations for board vice chair?
This is April Karn. I would like to nominate Michelle Kelly.
We're getting a nod no.
No, this is what you should say.
But is it, we have one nomination. Do we have any further nominations? Seeing none. Do you have any comments to the proposed nomination, Ms. Kelly?
Well, I'm happy to be nominated. I'm just wondering, I'm not sure if Jim Barnes is here. I think he's the current incumbent. I wonder if he was still interested in taking that position, because I would nominate Jim.
Oh, I'd be happy to continue serving. Whatever the board would like to do.
So we have,
Two nominations.
what's that?
Two nominations.
We have 2 nominations and 1 nomination from a person who's been nominated. So any further discussion?
This is Leslie. Just maybe an overview. What is the vice chair? What are their job duties or their function? Maybe that would help.
I will start by saying the first job duty is if I'm not present, he would be the one to run the meeting. So that is a primary duty. Sitting on other boards and commissions, a lot of times when I see the primary duty of the vice chair is to make sure that the chair stays in order, that if I I don't call public comment, to make sure I call public comment. If I miss a board member's comment that I need to, he keeps me on track.
He's your eyes and ears.
He's eyes and ears if I get distracted, to make sure that I don't miss an agenda item. And if we get to a stalemate and I say, does anybody have a motion, and we don't have a motion, it usually falls on the vice chair to make sure a motion does come forward. If we have a stall, I've seen on a lot of boards and commissions, that's where the vice chair steps in. And even if they don't agree with the motion, they will throw a motion for further discussion to move an item along. So that's what I see a vice chairman's role as being. You've been in the role.
I think that covers it pretty well. I think running the meeting in your absence is the main thing. But everything else, I think, is correct too.
This is Leslie again. I would just say that whoever has the role should have a good understanding of open meeting law. It recently changed. There were some new things around it in the last legislative session. So I'm not saying the nominees are bad or anything. I just was saying for those that we nominate, that they should have a good understanding of open meeting law, because it's very, very long. That NRS is huge, and and some new changes.
Okay, so what I'm gonna do is I'm gonna call for a vote in the order they were nominated, and we'll take a count at that point. So all those in favor of Board Member Kelly being the board vice chair, please signify by raising your hand.
Aye.
Okay, we have 2 board members, and we have 3 board members. So all those in favor of keeping our current vice chair as vice chair, raise your hand. You can't vote. And it's
Time. Jennifer's on,
Oh,
isn't she?
Jennifer's on. I can't see Jennifer. So.
Sorry, I didn't know I was off screen. I
Oh, there
voted
she
for
is.
Michelle Kelly, who might hate me for it, but there's my vote.
Okay.
Thanks.
So there is a majority of the board that voted for Michelle Kelly to be vice chair. So we will move forward with Michelle Kelly as being vice chair of the PEB board. Thank you for your time doing it.
You're welcome. Yeah,
Thank you.
sure.
Okay, so we'll close agenda item number 6 and move on to agenda item number 7, executive officer report. Ms. Glover.
This is Celestina Glover, interim executive officer for the Public Employee Benefits Program. So the executive officer report, hopefully you've all had a chance to review it. It's just an overview of some things that have been going on in the agency since the last meeting and since the close of the legislative session. First, we will have an agenda item for the legislative update, but we did track a number of bills in a number of them did impact the plan or may impact the plan. We'll go into more detail in the next agenda item. Next, we had open enrollment in May. And what we saw was similar to what we've seen in previous years. So we had 6,800 members that made a open enrollment selection. And the MSU, our call center, took 4,582 calls to assist those members. Some were as simple as having a password reset. Others, may have been questions about how do they go about changing the plans. We are seeing continual migration from the CDHP, the Consumer Driven Health Plan, to the low deductible plan. That was the biggest migration, but we also saw about 200 members migrate from the EPO plan into the low deductible plan. The table in the report reflects the primary members. That does not include their family members that may also be covered on our plan. The next thing is voluntary benefits. So in June, we were notified by CoreStream that there was an issue with the long-term disability benefit, that when the rates were calculated, they used the member's benefit rather than the member's salary. And long-term disability is typically rated based on the salary of the individual. So they proposed to recoup those undercharged premiums by spreading them out between July and December of 2023 so that there would not be one big hit on anybody's paycheck. So they would take it out over 6 months. They would send out a couple of notifications to let those affected individuals know what was going on. And we saw there was about 874 participants that were affected by this change. They agreed that they would not go back on any of the claims. So any claims that were filed during the period, they were going to honor those claims. And they were going to give the individuals the option of canceling their coverage without still having to pay the back due premium. So we reviewed their communication plan. We had a couple of meetings to discuss how they wanted to move forward, and between their staff and our staff, we came to this agreement that over the 6-month period that would, for the most part, work for most individuals, and allowing for the cancellation up through July 31st, provided individuals the option to actually opt out of that outside of an open enrollment period. And then finally, we have staffing as usual. We have staffing issues like the rest of the state. Currently, we have 11 vacant positions. That includes the executive officer position that I am currently filling as interim. I was brought in on a contract, so I'm a resource. I'm not actually a full permanent employee of the program or of the agency. But we did managed to fill a couple of vacancies. Jessica Crane, she is our executive assistant. We promoted Michelle Whalen to the chief financial officer, and I am working with her to make sure that I fill in the blanks for the things that she's missing as far as knowledge about certain things that she will be required to do, OPEB reports, financial statements, things like that. And then our eligibility supervisor, Wendy Luntz, was promoted. She was the previous executive officer. 2 of those were internal promotions, so it just moved them from one position to another. So we still have those vacancies. As Chair Rob had mentioned earlier, with the transition back to the NEAT system, it did delay some of our recruitments, but we are starting to see them roll out. And as we close those recruitments, we get applications, we are reviewing so that we can get those positions filled, so interviewing applicants and getting hopefully some good qualified staff in to fill the vacancies. And with that, I'll take any questions.
This is Leslie. I have a question on the vacancies. Are you getting applicants applying? Are you getting multiple applicants, just looking at the quality of the folks that are applying?
So a few of our recruitments have been internal. So yes, as far as that goes, because we're looking at people who already are in positions and they're promoting to a higher level position. So definitely there, we have some good candidates. The accounting assistant 2 position recently became vacant, and we just got the list of applications for that. And he says, cool, it's not a list. And we received 7 applications for open competitive recruitment. So for an accounting assistant 2, it's an entry level position. I was hoping we'd get more. Those interviews are scheduled for next week. So we'll see. On paper, they look fine until we get to talk to them. And then we received 9 applications for the ASO2. That was a statewide promotional. You tend to get more with ASO2 because you've got people trying to promote within the state. It looks like we have at least 5 that are looking like really good candidates. Those interviews will probably happen the following week. So we're still kind of vetting those applications at this point. Nick, did you have anything on your vacancies?
I'm Nick Broke for the record. We are currently working on having like an open-ended recruitment for MSU. just no deadlines so people can apply because it's constantly vacant. It's like never full. So we'll just constant recruitment and then look at the pools each time, like, you know, every month or however long.
Any other questions?
Michelle Kelly, Chair Rob.
Okay.
Yeah, thank you. Executive Officer Glover, I'm going back to the voluntary benefits update, the long-term disability. I'm sorry, I've got so many questions. Firstly, how much, what's the total dollar amount? So I see there's 874 participants impacted by this. What is the total dollar amount that CoreStream will be collecting?
So I can give you, this is Celestina Glover for the record. I can give you the range of the amounts that are going to be recouped from the individuals, but what the total dollar amount is, I don't have that in front of me. It's anywhere from $12 to $55 was the amount that we were told. So your higher paid employees are going to be at the higher end of that recoupment, and the lower paid employees, since it's based on their salaries, will be at the lower end of that recoupment. But
I'm sorry, was that per month?
Yes.
Okay. So I'm just curious about the contracting here. So when our employees signed up for this product, whenever they did, whether it was in 22 or plan year 23, how was the premium, the monthly premium to them communicated? And you know, what amount was communicated? Was it the correct amount? Was it not communicated to them what their premium would be? I'm just trying to understand. I guess from my perspective, I don't understand why we're allowing CoreStream to come back to our employees and charge them for a premium that is their error for not collecting. You know, and I understand that there's dollars at stake here, but our employees have participated in this program for 12 months where CoreStream, I'm assuming it was CoreStream, has charged the wrong premium. That's not on our employees, that's on CoreStream. So what kind of negotiation was done to minimize the impact on all of our participants, whether they're low paid or high paid? You know, I mean, this is a huge error from a vendor.
Nick Roper for the record, you're absolutely correct. It is a huge error. We did have many conversations with them and it was a calculation error. So when the members went to enroll, they did see the incorrect premium. So you're right, that is through no fault of the member's own. But the total cost, CoreStream would not eat this, the standard, because it's the standard who administers this benefit. They would have to eat over $100,000, which they wouldn't really be willing to do. And so we came to this agreement of members pay the premiums back or they have the option to cancel. And we also did reach out to the DOI to see if there was any regulatory oversight or anything within our control or power. And we are still awaiting a response. And we had to move forward with a direction or everybody's policies would be canceled. And I wasn't willing to take that risk of just cancel their policies. So we went forward with this. We approved the communication from CoreStream. And you're right, we absolutely agree. It's not the member's fault, but the standard will lose out on a lot of money or people's policies would be canceled.
Aren't we paying them over $3 million for this, in premiums for between life insurance and long-term disability? What is the total amount that the standard collects from PEBP on a plan year basis?
Nick Proper for the record, we would have to pull that data, but it's salary driven, age driven, member driven. It's not the same premium for every single member. It's all these factors that you have to consider. And then that calculation is how they get the premium. So obviously the calculation was wrong, given
vacancy rate is 30%. Transition.
So,
What is
sorry, Michelle.
We have a
So-
laptop.
It's gonna answer your question for you.
I apologize.
I guess, Nick, from my perspective, what I'm thinking is that, you know, you said it's $100,000, it's a lot of money.
Yeah.
But if our contract with the standard is $3 million a year, then it's a small percentage of what we pay them. And so, you know, I just,
PEB
you know,
does not
going,
have a contract with any of these voluntary vendors. PEB does not pay any of them directly. We do not pay the standard.
so not even for long-term disability anymore? Sorry, life insurance, they're not our provider?
Correct. They are not our provider for basic life insurance.
Okay, okay.
Yeah.
All right, so let me move on to communications then. So obviously you did state that employees were given the wrong premium when they actually signed up for this product, which to me is kind of binding, honestly. I'll be interested to see the legal opinion when you get it. But so they were, you know, they signed up during open enrollment for this product, which could have been any time in May of 2022. Now we're going to be communicating with them off cycle. So how are you going to ensure that 874 employees absolutely get the communication, read the communication, understand the communication, and then take action?
Nick Pro, for the record, can we really know if somebody's going to read and receive every communication? That's been a gap that PEB and every agency continues to have. We know that the emails were sent. We have received feedback from members that they have received these emails from CoreStream. And in the communication itself says, do not contact PEB, contact CoreStream directly to work it out, because PEB is not in the loop of administering these benefits. We do not administer them. CoreStream does. So the direction to contact CoreStream is correct. And multiple emails with the deadlines have been sent.
And have you pulled in the agency HR people so that they can also outreach their employees if they so wanted to?
That is something we can absolutely do.
Okay, so and just one more question, I'm sorry, I don't mean to monopolize, well, but I can't help myself. So it sounds like communications have already happened on this. So when did the communication plan start? And then I'm curious about when employees have to cancel the insurance by, and then what is the backup plan for when we hear from employees in January or February of next year saying, why did my premium change? I don't really understand. Are we going to allow them to pull out of these insurances through the rest of the year as they realize that their premium changed and it's much more than they expected? What's the timeline there?
So Nick Proper, for the record, as in Tina's executive officer report, the deadline is the end of the month to cancel. And that is a soft deadline. We've communicated internally to CoreStream that if members call CoreStream after July and want to cancel, that they will honor it.
So at the moment, we've got 3 days left for participants to cancel.
This is Celestina Glover, for the record. That's correct. Communication started going out at the beginning of the month, so about after the first week of July. And then another communication went out this week, explaining to those individuals affected by this change what their options were, what they needed to do, and what they could expect as far as recouping those underpaid premiums. If we get some direction back from the DOI that gives us more of a hammer where we can go back to the standard and to CoreStream and say, no, you can't do this, you're going to have to undo everything you did, then that's what we'll do. But until we get that direction, what we're being told by the standard is if they can't recoup the premiums, then they would cancel all policies. And that was something that we didn't want to happen, because even with the increased premiums, we know that there are individuals out there that still would want to keep that benefit. They've been paying for it for however long they've been enrolled, and they don't necessarily want to risk losing it even at a higher cost. We do know that there are some individuals who will decide that it's not worth it and they will cancel their policies. If they call us after July 31st or call CoreStream, we will work with those individuals on a one-by-one cases to see what is going on and to make a determination as to whether they should go ahead and cancel their policy and where we go from there. And until we get that feedback from DOI, we're really right now, we're in a holding pattern, but we have to do something. We can't just say, we'll cancel everybody and then we'll come back and look at it in a few months. So it was, neither choice was great, but we felt like there was probably, out of the 874 people affected, that those individuals, a number of them would not have been happy if we just let their policies lapse.
Absolutely, I would agree that you can never win. I guess so who, can you use the acronym DOI? Who is that? What department is that?
Department of Insurance.
Okay, and have we had our DAG look at the contract? For, I don't know whether, was it the standards error? Was it CoreStream's error? Who actually made the error? And who do we have the contract with? Because I would think that PEB is at risk right now because, you know, we offered a product at a certain cost, employees signed up for it, and sure, you're going to give them an out. But in order to continue, obviously, you're saying they have to pay the back premium. So I'm just kind of curious about the internal process to for our lawyers to confirm the contract actually allows CoreStream or the standard to do this. I mean, I'm just surprised there's so little protection for our participants, in all honesty.
I'm trying to catch up here. This is an opt-in program. And you administer it as an opt-in program. And what you do is you negotiate a cheaper rate because you did have 874 people enrolled in. So these 874 have an option to not pay this premium or go to the open market to get the same type of benefit. And I would have to say, if they go to the open market to get the same type of benefit, it's probably still going to be a reduced cost paying this back charge than what the open market would provide. So yes, it's additional money, but in the end, because we have this as an option, it's saving our employees money. The people that opt in are still saving money. It's costing more, but if you were to look for this type of benefit on the open market, it would probably be considerably more. So I understand what board member Kelly is suggesting, but I'm also saying that these individuals have a benefit and there's a cost to that benefit. They were charged the wrong cost. They have options right now. They can, if it's on the $55 end and they can go to the private market, good for them, and get a cheaper price. There's options. Nobody, it's unfortunate. It truly is. It shouldn't have happened. I agree with that. But it's business and we have to move forward.
Just to be counterintuitive, Chair Rob, that's not necessarily true because some people may have signed up for this benefit because during its first rollout, they weren't subject to evidence of insurability. So they may have signed up for it then and not wanted to do any health questionnaires. It was just easier, not necessarily cheaper. And then there's also people who, you know, who maybe signed up for it at the time, super simple, and now they wouldn't even pass evidence of insurability, which is, you know, that's something from the, you know, from the open market that people have to navigate. So often the premiums are no better, but just that evidence of insurability requirement. But so saying that, I understand you want to move on. So
yeah,
thank you.
I do, Jack off the record, I do want to make one more comment. I don't know out of the 874 that are affected, how many benefits were paid out. And they said that they would honor the benefits that have been paid to date. So that's part of insurance, is paying the benefits. And I don't know if any of the 874 received benefits, but even though they weren't paid in full, the company said we will honor all those benefits to make these people whole. So that's, I think that's meeting us halfway. through the air. Actually, they do.
This is Celestina Glover for the record. Keep in mind that the standard, that contract is not with PEB. They are a vendor on the voluntary benefit platform that our members can go to and decide whether or not that's a benefit that they want to enroll in and pay for. Chair Rob is correct. They did honor any claims that they already had, and that wasn't going to be affected. And those individuals who choose to cancel their policies will not be required to pay that back premium. So that is the two things that they were able to guarantee to us, that they would not somehow try to get somebody to go back and pay for the time that they were insured where those premiums were incorrect. And as I said, if we get other information and we can do something different to help our members, then we will.
Any other board member discussion? On anything on agenda item number 7, we've covered a couple of topics. All right, seeing none, we'll move on to agenda item number 8, legislative tracking report. Discussion regarding legislation passed during the 82nd legislative session in 2023. Interim executive officers, Ms. Glover.
Yes, this is Celestina Glover for the record. Before you is the legislative tracking report. So there were over 1,200 BDRs that were submitted. PEB tracked about 194 that ultimately became bills. Of that, we had about 17 or so bills that affected PEB, which may have required a change to the MPD. It might have been something that we were already covering, so no changes were needed. And in some cases, those bills may affect the long-term cost to the plan. So something to keep in mind in all of our different legislative updates. What I did is I simply summarized, or actually Mr. Lindley did, summarize what bills we were tracking and the section of the bill that affected either other statutes that PEB follows or PEB's own statute. I didn't try to quote what the entire bill was, because some of those bills are 60, 70, 100 pages long. So what you'll see is a list of bills that we did feel like we wanted to keep track of. So AB 155, which is the biomarker testing, have already provided what we refer to as genetic testing. So that didn't really cause us to have to make any changes. It was already something that for medical necessity, we were covering. AB 156, which is the substance abuse disorders. A lot of the bills that we were seeing were affecting not only benefits that we provided, coverage that we already have in our plans, but it may change how we administer those benefits. So you're going to see things like, you have to allow all these drugs to be used that maybe weren't on our formulary in the past. I think in our case, most of the medications that they were talking about were already on the formulary. You'll also see that we can't use medical management techniques or step therapy. Some of them said accept step therapy. So step therapy can be used if it's for medical necessity. So the physician is trying to make sure it's the right medication for the right person, the right dosage for that purpose. But if we're using it for a cost-saving measure, then we cannot use any medical management practices. We cannot use any step therapy practices. What will that do to the plan? What will that do for the individual? We won't know until we start seeing those practices put in place. Some of the cost saving measure, they always look at like, oh, the insurance companies are trying to save money, PEB's trying to save money, which is true, but ultimately, if they're on a lower cost medication or a lower cost treatment, it's also lower cost to the individual, not just the plan. If we have no cost control measures in place, then ultimately it costs everybody more because if it affects the cost to the plan and we have to raise the rates, if we don't get increased subsidies when we go to the next legislative session, then the premiums will have to go up or the benefits will have to be reduced. So ultimately, everybody pays when we aren't able to save on any cost. So when you see that in some of these, that's something we're going to be monitoring. Is it having a serious effect or is it not? So SB 163, the next one that we were tracking, it's covering certain treatments and conditions relating to gender dysphoria and gender incongruence. Yeah, I can speak today. We already provided some of this care to start with. We already had benefits in place in our plans. This also directed what standards of care needed to be considered when any of these types of treatments are provided. Then 167, that goes back to step therapy in certain circumstances. Again, the step therapy that they're talking about is if it's a cost-saving measure, if it's treatment related. So you get a certain dose for whatever medication for whatever condition, and the doctor determines that that dose isn't appropriate or even that particular medication isn't appropriate, they try something else. That's not necessarily a cost-saving measure that the plan is put in place, but it may be something that the physician is working with on their patient. That would be allowed, the cost-saving side. SB 280, this is related to contraception at the time of birth. So we don't expect this to really have a major effect on the plan as far as a benefit we offer or don't offer. That's not an issue for us, and we don't see that the cost is going to be something that we're going to be concerned about, whether it's for the plan or the individual. SB 439 is related to provisions related to communicable diseases. And so that bill just outlines what we need to provide as far as benefits within the plan. And so any of our MPDs that needed to be updated, those steps have already been taken. The next group of bills, they're primary telehealth, and this came out of the COVID emergency declaration. So essentially what the legislature did was reverse, or instead of letting them sunset or end, they're just going to continue as a normal benefit. So for dentistry and for, which is AB 147, and then SB 119 is telehealth. We already provided for telehealth in the plan. Teledentistry came on with COVID, and we did not change the MPD to remove those provisions. And then we had some general administration bills. So open meeting law, we had a lot of changes in the open meeting laws. And we have some changes regarding health information exchanges. So having to do health records electronically. PEB's already positioned itself through its contracts to make sure that when these things go into effect, a lot of these bills have multiple effective dates, depends on what type of facility. Are you initially just getting your regulations and statutes updated? And in some cases, it's, if you're a big facility, you have to comply immediately. If you're a smaller provider, you may have some additional time. So AB 7 is our electronic records. It's continuing a committee that the executive officer is now an ex officio member of. DHHS is the one that is heading that up. AB 52, AB 219, both of those are affecting open meeting laws. So what the two bills did, the first one allows for your quorum to not be considered with vacancies. So if you have vacancies on the board, those positions are not counted as your total number of available board members. So you can have a quorum essentially with fewer people. It also talks about having to deliberate before any action is taken, talks about public comment. If you're deliberating about an individual, so our QC officer reports to the board chair. If for some reason there was an issue and they wanted to discuss that certain notice would have to be sent out. Same thing with the executive officer position. If there were some issues going on, they would have to send a notice to me in writing that says, we're going to talk about your performance or whatever it is that they need to deliberate. So that is something I think that we already had in place, but now it's been updated in law. And then 219 essentially talked about when you have a group of board members at a functions, this is how we kind of interpret it internally. If you have a group of board members that all happen to show up at the same function and you have a quorum by the number of board members that are there, as long as you're not deliberating about anything that you have jurisdiction over, then it's not an issue. In the past, when we would go to a conference or something, we would limit the number of board members that could go so that there was no possibility that a quorum would be there and then by chance start talking about something, make a decision, you haven't had the open meeting. So this allows for, this is probably going to happen more like legislative sessions where a bunch of people could show up at once, social functions, things like that, where you potentially could have a quorum in the count of board members that could show up somewhere. Then SB 272, this is related to governmental administration. So this one might be a little bit more difficult. This is a bill where they're requiring agencies to post out on their websites where it can be plainly seen. You need to list your contracts and identify the contracts that are owned by veterans, by women, by minority groups, by LGBTQ, how much those contracts are for. We will follow this law. Where I can see some concern is whether or not the owners of those companies will disclose the information to us. So it's not necessarily going to be, I don't want to put it out there, but it's very delicate to ask, is this a woman-owned business? Is this a minority-owned business or whatever the question is? Because you got to kind of step carefully through a potential minefield of asking who owns these companies, because you may get the why do you want to know whether, and we're just trying to post information. So we will follow the law. Right now, I couldn't tell you who owns our companies. We have a lot of big corporation type companies. So is there an owner or is it a board? Is it the public because it's publicly held? Those we'll have to look and see where we're at with those. We can definitely put how much our contracts are for once we have this information. And then SB 419 is related to public health. So this again goes back to including us in NRS 439. And this is requiring notice to regulatory bodies if there's an insurance provider not in compliance with the bill. We're not really a regulatory body in this way. It has revised NRS 287, which is the statute that PEB is under, to add this section of the 439. So I'm not quite sure how this is truly going to affect us. But again, we build some of these considerations into our contract. So if our vendors need to comply with this, then we will make sure that they're made aware of it. And then the last one, the last group are appropriations and authorization bills. So these are the bills that set our subsidies, which would be an SB 501, SB 504, which affects the entire state essentially. That's our expenditure bill. And SB 511, which provided for the additional general funds into our budget account so that we can pay the increased health or life insurance, excuse me, and the health savings accounts. And with that, I'll take any questions.
Any board member questions? Seeing none, we'll move on to agenda item number 9, discussion and acceptance of Claim Technologies Incorporated audit findings for the State of Nevada Public Employee Benefit Program administration by UNR for the period January 1, 2023 through March 31, 2023. Interim Executive Officer, Glover. Yeah, not giving you any breaks.
This is Celestina Glover, Interim Executive Officer for the Public Employees Benefits Program. Before you is the third quarter audit conducted by our claims technology vendor. They will go through the audit. Are they on the line?
I am.
Okay, good. And I will turn it over to CTI.
I'm here. Good morning. For the record, my name is Joni, Joni Amato, Amato. And I'd like to direct you to page 3 of the UMR audit report, the executive summary section. The scope of the UMR audit included claims processed during the period of January 1, 2023 through March 31, 2023. The audit included both medical and dental claims. The medical and dental claims paid during the during quarter 3 totaled approximately $61 million and approximately 204,000 claims were processed. The audit included the 4 components of quarterly performance guarantee validation, 100% electronic screening with 150 targeted samples, a statistically valid stratified random sample of 200 claims, and lastly, data analytics. In our auditor's opinion, UMR's financial accuracy, overall accuracy, improved in this quarter while the claim turnaround time decreased compared to the previous quarter. The performance guarantees were not met for financial accuracy, overall accuracy, and both of the claim turnaround time measures, the 92% processed within 14 days and 99% processed within 30 days. This results in a penalty of 4.5% of the administrative fees for the quarter, or $55,681.34. We recommend reviewing the financial errors identified in the random sample audit to ensure that root causes have been identified and that claim processor training or system corrections have been made where appropriate. And similarly, we recommend review of the electronic screening and targeted sample results to focus on any potential recovery and any potential process improvements that can be made. Thank you.
Thank you. Any board member questions?
Question. This is Leslie Bilston for the record. Out of those claims, and this may be a strange question, but how many of those were like system coding errors versus human errors? Yeah, okay.
I'm sorry, there's a mix. When you look at the report, I don't know the number off the top of my head, but when you look at the report, the detail part of it will show you if it was a manual processing error, an M, or a system processing error or an S. So next to each error identified, we also indicate if it was manual or a system error. So it is a mix of both.
Is there a higher number of system or a higher percentage of system or human or manual? Or do you know?
I think that it's probably more manual, but I don't want to promise that. I'd need to go through and count the different ones, but it typically we see that manual errors are higher.
Board Member Kelly, you have a question?
Thank you, Chair Rob. Michelle Kelly for the record. So I'm just wondering, you did state at the beginning that I think some of the measures were improved over Q2, or because this is our third quarter, so Q2. I'm just wondering, in your professional opinion, are the improvements from Q1 to Q2, now we're into Q3, I think we'd been promised that everything would look much better in Q3. I'm not sure it looks that much better, but can you perhaps give your professional opinion, like, are they making strides to correct these things in a timely manner, or is this very slow improvements and they are going to continue to have issues in Q4?
I think I looked at the financial accuracy has stayed about the same. There was a little bit of improvement from Q2. Overall accuracy has improved substantially from the first quarter audit. For example, in the first quarter, I think it was at 91%, and in this quarter, it was at 97.5%. So they're closer to meeting that performance guarantee. The claim turnaround time is a little bit different. It decreased in this last quarter. As far as for both measures, in the quarter two, they had met one of the performance guarantees. There's two for claim timeliness, and they had met one of those in quarter two. In quarter three, we saw that slide back to not meeting both. So we see some improvement in the financial and the accuracy measures, but claim timeliness has not.
Okay, thank you. Michelle Kelly for the record. Once the committee members have finished asking questions, I wonder if we couldn't hear from someone from UMR to address what they're doing to fix these things again.
Yeah, this is Ahmed Brown. I'd be happy to comment after you're ready.
Are we done with questions with the audit? Go ahead.
I have Janelle Woodward for the record, just more of a comment. We saw some of the public comment that came in at the last minute yesterday, and they were about UMR's accuracy. And my concern is, from the employee standpoint, when the claims aren't paid in a timely manner, you get turned over to a collection agency. And there are multiple results of that, effect on the employee themselves. So I would like to hear them address that when they get back, or their comments back.
Okay, please proceed.
Okay, so yeah, this is Helmut Braun jumping in here. So I would tell you on the claim turnaround time, obviously third quarter is from January 1 to March 30th. And obviously that first month of the year is usually our most challenging month. It's our highest volume month. And that's part of what drove that. I think we made some progress on that for fourth quarter, and obviously some progress now. I mean, our claim inventories have been in that 12 to 13,000 range level, which is pretty solid, I think. That's probably 3 to 4 days worth of inventory. So I would expect continued improvement in the turnaround time. As Joni said, we've made some progress on the financial and overall accuracy. We're continuing to do some additional audits from that perspective to manage that better. And I do think we're making some improvements. Obviously, any of the system improvements or system errors that we find, we go back and identify those, find the root cause, make sure we make the system changes. And we're also re-educating our staff that has made the manual errors. So I am hopeful that, the fourth quarter is going to be better. Like I said, we're definitely seeing some improvements in the turnaround time. So I expect that these numbers will continue to improve over the next couple of quarters.
Any further questions?
Chair Rob, Michelle Kelly for the record.
Yes.
Mr. Braun, I'm just wondering, So as one of my colleagues said on the board, we've heard some complaints from the public regarding customer service, the website. I think it gets tied up in kind of the inaccuracy and these issues that the auditors have found. So I'm just wondering a couple of specific things. Firstly, the website is problematic. And I wonder if you've had this feedback from other participants, but even I've been out there and I've clicked here and clicked there, and it kind of takes you half an hour to find actually what you want, because you go down a lot of dead rabbit holes and things like that. So I think the website's very problematic for our members, and I've seen that in public comment as well. But just generally, the customer service when people are having appeals, or they're having preventative claims denied and then they're having to appeal it. I saw a communication yesterday from a staff member at NSHE that he was told that in order to process their appeal, they would need 6 months of medical records. And I'm just wondering why. Basically he was appealing that you guys had processed something under the deductible and copays as opposed to preventative. I think that and he was given 5 days to provide 6 months of medical records to UMR to process the appeal, or the statement was, or we'll use what we have right now to process the claim, which he assumed was a denial, which I think probably rightly so, right? If you could approve it with what you had, wouldn't you have already done so? So I guess, my big bugbear with any agency, with any contract we have, is that customer service, because in the end, we're all here for our employees, for their health insurance. So can you talk about customer service measures and what you're doing to kind of improve the turnaround time? One of the things I heard from participants is that where HealthScope/UMR, because you guys were one and the same before this contract, we used to have a person in the PEB office to kind of be that patient advocate. I thought that position was still there, but I'm hearing through public comment maybe that it's no longer there. So what are you doing to help our employees navigate kind of the trials and tribulations of accuracy and timeliness of claims?
Well, I guess I would say a couple of things. Okay. I'm a little surprised that we gave somebody a 5-day limit to get us records. Okay. Because we're certainly willing to give more time than that if it takes longer than that to get it in. And in a lot of cases, we'll reach out and ask for the medical records ourselves. So if there's any chance that you can give me the name of the person that was having those challenges, I will certainly have somebody look into that situation and see what occurred there. All right.
Let's do that offline.
Yeah. So if somebody will email me that offline and just let me know who that person was, we'll have somebody look into that and figure out what the situation was there. And like I said, in most cases, we'll make those medical record requests if required. If somebody sent in an appeal, then we will certainly make an effort to get the records from the physician or the facility or whatever the case might be. We do measure, how long it takes us to turn around open issues. The appeals are a little bit more challenging sometimes, partially because you do have to get records, and we do have to get some of the clinical people involved. And I do know we've had some, at least in the first quarter, we had some challenges with some backlogs on the clinical side. So some of those appeals have taken longer than we'd like. I think we're still within the statutory requirements, but obviously, sometimes even when the requirements give us 30 or 45 or 60 days, that doesn't feel very good from a member's perspective who, we'd like to service those things in probably less than, 10 days or 2 weeks at the most. All I can tell you is that we're continuing to work on and measure each of those things, and certainly we'll do our best. And if there are specific issues that we can help with, if you give us any names or situations, I will certainly make sure we have somebody look into that. With regard to the person that was on site, I do believe we still have that person working. I'm just not sure they're on site, but we can still refer situations to them. So if somebody at the board or at the PEB office has something they need addressed, we do have contacts that they can connect with to make sure those situations are sort of resolved in an escalated fashion.
Okay, thank you. So can you just, in the past, when a participant, so for example, a provider did something the participant thought was preventative and they were billed under the deductible and copay structure. In the past, an employee could literally just call HealthScope and say, hey, this has been processed wrong. Can you relook at it? It doesn't seem, and they would talk to a real person, and I've done it a few times myself with HealthScope where they go, oh yeah, I see that, let me just resubmit. Is that process still available, or does everybody have to go through this formal appeals process? Because I feel like just since UMR have taken over the contract formally, so, you know, July 1 of last year, I feel like I keep hearing about this appeals process that is broken, but people really never had to use the appeals process before. There was kind of an interim step. So can you talk about that? If a person's unhappy with the way something was processed, what can they do?
Well, they should be able to call up one of our customer service people and ask about that and at least get an explanation. And if after that, okay, and perhaps it was processed wrong, perhaps they could fix it right there if they can recognize that was the situation. If not, then we probably require an appeal. Now, I think Darren Ashby might be on the phone, who is the director over the Nevada Health Plan and has been from HealthScope from way back. Maybe Darren, you could address this, and I'm assuming that option is still available for everyone to just call in customer service and talk about some of these preventive situations.
Yes, it is. And in fact, you know, when a member does call in and or a provider in question regarding a claim and how it's been processed, in their review, if there is a determination that, as Helmut mentioned, that the claim was processed incorrectly or not handled appropriately, that can be sent over to the claims unit as a call track, and that is reviewed by the claims unit. And if it is determined that that in fact can be paid, then it should be paid at that point in time without the need for an appeal. The only time that we really should be requesting an appeal is if the denial that took place was based on either plan documentation or plan benefit limitations, or if it had been determined that it was not medically necessary by a medical director or something of that nature. But if it's something that truly just was an incorrect processing, they should be able to just contact customer care and have it resolved through that process.
Okay, thank you very much. And I'm gonna reel us back in a little bit because I truly appreciate the questions and I appreciate the answers. But the agenda item is for discussion accepts the Claim Technology Incorporated's audit findings, and we're getting a little bit into the weeds here on day-to-day operations. So reel it back in. Do we have any further discussion on discussion acceptance of Claim Technology Incorporated's audit findings?
Betsy Strasburg for the record. So is the assumption is all the audit findings that the external auditor found is agreed with UMR for resolution? That's the first question. Or are there any findings that they disagreed with? And was there resolution between the auditor to resolve the difference? The second question is, there's a lot of resolutions identified here in the response to the audit, but I don't see any timeline. So does that mean this is all going to be resolved by the next time an audit is conducted? Thank you.
This is Joni Amato for the record. I believe there's just one item that CTI and UMR disagreed on in the random sample audit. All of the other items were agreed upon. So I think it's a case where we agree to disagree on a preventative item.
But it's still their report. So they
Yeah,
can agree to disagree, but it's still their report.
The second question was the timing of the resolution, the action items that UMR will take to resolve the other items where they did agree on.
Is that for CTI or for UMR?
UMR. Mr. Bond?
Yeah, this is Helmut Braun for UMR. So we are working on resolving all those items. Now, here's what I would tell you though, that this audit was just recently completed. And so the fourth quarter has already happened. And so you won't see any of those changes in that fourth quarter. You should see them for the first quarter of the next year that we'll have those implemented.
Thank you.
Okay, thank you. Any further discussion? This is an action item. I'll entertain a motion for acceptance of the audit.
Michelle Kelly, for the record, I made that motion and propose that we collect the penalties as indicated by CTI.
Motion, do I have a second?
Sid Boston, second.
Okay, we have a motion second. Any further discussion? Seeing none, I'll call for the vote. All those in favor signify by saying aye.
Aye.
All opposed? Motion passes unanimous. We'll move on to agenda item number 10. Presentation and possible action on status approval of new PEB contracts. PEB contract amendments solicitations. Michelle Whalen, Chief Financial Officer.
Michelle Whalen for the record. Section 10.1 is the contracts overview chart. We've recently added Ide Bailey as our new financial auditor for approval of previous board meeting. And look forward to working with them for the 2023 single audit. No actions necessary. Section 2, new contracts. There are no new contracts. Section 10.3, contract amendments, no new contract amendments. Section 10.4, contract solicitation ratifications, none at this time. Current solicitations, the Center of Excellence Travel Concierge, the evaluation committee met and selected a potential vendor. Those negotiations will be starting here in the next week. More information will be available once we complete those negotiations. In the oncology management program, we expect to have that RFP released here within the next month. Any questions?
Board Member Kelly, you have your hand raised. Do you have a question on the current item?
Sorry, no, I don't.
Okay, thank you. Any other board member questions? Seeing none, we'll close agenda item number 10. We'll move on to agenda item number 11. Public comment. Public comment will be taken on this agenda. Looking during the agenda item. I see we have public comment person.
Good morning, still Kent Irvin, ERVN, past president of Nevada Faculty Alliance. It really wasn't that hard to find this location, but I had a flat tire on the way. So I'm a little late. Good morning, Chair Rob, Executive Officer Glover, and committee members. I did get to phone in, but in response to some of the previous agenda items, Mr. Braun at UMR indicated that there's still a UMR advocate or ombudsperson for PEB participants. Our members clearly don't know how to get in touch with that person. So who is it and how do PEB participants get access to them? On the Oncology and Center of Excellence RFPs, I truly hope that there are processes in place to determine whether those programs, when they are put in place, that they fulfill their promises made as far as both providing better services and saving money for the system. Otherwise, we're just going out and creating new programs that vendors like, but not necessarily that help our participants, and sometimes can even provide higher hurdles to getting help with their healthcare needs. So with just those two extra items, thank you very much, and thank you for your service.
Thank you. Appreciate it being here. Do we have any public? We have a couple of comments online. So
One moment. Chair Rob, we'll get up the slide again. For those who have joined for public comments, your name or the last 4 digits of your phone number will be announced and you'll be advised you have been unmuted. Please slowly state and spell your name for the record and proceed with your comments. As a reminder for those on the phone, please press *6 to unmute. Due to time considerations, each caller will be limited to 3 minutes. Mr. Unger, you have permission to speak. Please slowly state and spell your name for the record.
Doug Unger, D-O-U-G-U-N-G-E-R, President, UNLV Chapter, Nevada Faculty Alliance, and Chair, Government Affairs Committee. Thank you to the board and representatives of UMR for the discussion about UMR customer service. I'm following up because I want to make a point, hoping that UMR representatives are listening, that there is a difference in tone between having dealt with HealthScope and now dealing with UMR. What I'm hearing from our constituents is that when they deal with UMR on an appeal or a possible denied claim, they are treated like deadbeats. It is extremely discourteous, the treatment that they're receiving. And also that UMR's communications to healthcare providers really treats the patient as though the patient is deficient and not as though there might be a mistake or the claim is being reconsidered or something is being reprocessed. I would most respectfully like to request of the representatives of UMR that they have an internal meeting to really discuss the tone with which they are addressing Nevada state employees when we raise issues. I've been on the receiving end of this myself and was, quite noted the difference between HealthScope and UMR and the tone of the communications. Thank you very much for this meeting and the frank discussion, and thanks for all the progress you're making in your representation of Nevada state employees. Thank you very much.
Thank you.
Thank you. The caller with the last 4 digits, 0891. Please slowly state and spell your name for the record if we wish to make public comments.
Good morning, Chair Robb, Vice Chair Barnes, and Interim Executive Officer Glover. My name for the record is Terry Laird. I'm the Executive Director of RPEN, the Retired Public Employees of Nevada. RPEN is a nonprofit, nonpartisan, membership-based organization with around 7,500 members statewide. I support the comments made at the start of the meeting by Mr. Unger and Mr. Irvin with the Nevada Faculty Alliance. RPEN worked alongside the Nevada Faculty Alliance and other members from our Public Employee Coalition at the 82nd Legislative Session, and we're happy to see state employees' wages and benefits improve to make them more competitive. We were also happy to see life insurance for actives and retirees return to pre-COVID levels. However, we were not satisfied that other PEB benefits, especially long-term disability, was not addressed. After hearing the discussion today about filling the executive officer vacancy, it would seem that that will be a difficult process again due to issues with executive pay restrictions PEB apparently still faces. We hope PEB will be able to fill the vacancy sooner than later and find someone who knows the issues PEB faces, as well as someone who can be compassionate to the problems members in PEB face, particularly Medicare retirees in the exchange who continually have ongoing problems with VIA benefits and apparently no longer have an advocate since Stacey Nelson no longer works with PEB. Also, since 2015, RPEN has offered PEB a voice through our quarterly newsletter, the RPEN Review. The PEB column called Health Matters has been written by former executive officers Haycock and Rich, giving PEB retirees on the Medicare exchange updates at PEB, like open enrollment, that they might not have access to because PEB's internal newsletters are listed online only. And as you know, many retirees unfortunately still do not have internet access for one reason or another. We hope the next executive officer will be willing to take advantage of this to keep your members in the know who might not have the information otherwise. Thank you for your time.
Thank you. That concludes public comment. We will move on to agenda item number 12. We're adjourned. Thank you.
Thank you.